Hello, my name is Dr. Carlin Nelson from Coppin State University's College of Health Professions. I, alongside with Dr. Joan Tilghman, who's the Dean of the College of Health Professions, are here to present our presentation. This presentation summarizes a structural needs assessment supporting a certificate of need to expand behavioral health services in West Baltimore. This project focuses on zip code 21215 and 21216 in West Baltimore. Both these communities were historically redlined. In the 1930s, federally backed housing maps labeled many Black neighborhoods as hazardous for mortgage lending, which restricted investments and wealth accumulation for decades. These structural decisions continue to shape present day economic and health inequities. So, when we examine behavioral health disparities in this area, we are not examining individual failure, we are examining structural legacies. Coppin State University is embedded directly within zip code 21216. As an historically Black college university, Coppin plays a central role in fostering leadership, civic engagement, and economic development within West Baltimore. This position uniquely situates the university to serve as a community health access anchor. This assessment evaluates whether expanding campus embedded behavioral health services is justified through a certificate of need. So this was a secondary data needs assessment that utilized the American Community Survey indicators across social determinants of health domains and the National Plan and Provider Enumeration System, which provided practice location data. Zip code 21215 includes approximately 52,000 residents, and 21216 includes approximately 27,000 residents. Together, these zip codes represent nearly 79,000 individuals, one of the largest concentrated population clusters in West Baltimore. This assessment was guided by the Healthy People 2030 Social Determinants of Health framework. We evaluated indicators across economic stability, education access and quality, healthcare access and quality, social and community context, as well as the built environment to determine whether behavioral health infrastructure aligns with structural conditions in these communities or in this community. So approximately 17 to 18% of families in these zip codes live below the federal poverty threshold. Additionally, roughly 29 to 35% of households receive supplemental nutrition assistance programs or SNAP benefits. And these indicators reflect concentrated economic hardship or vulnerability, which is a well-documented driver of chronic stress exposure and increased behavioral health vulnerability. Although overall insurance coverage is high, approximately 42 to 45% of residents rely on Medicaid or some type of other public insurance. High public insurance reliance signals substantial safety net demand. However, provider participation in Medicaid for specialty behavioral health services remain uneven, limiting functional access. So essentially, coverage does not necessarily always translate or automatically translate into care. In zip code 21215, there are approximately 2,567 registered provider practice locations when you compare it to 459 in zip code 21216. However, these counts reflect all clinical specialties and do not represent confirmed behavioral health capacity. So some providers' presence alone does not ensure adequate behavioral health access. When we synthesize these findings, a structural mismatch becomes clear. There's a substantial population scale, concentrated poverty, high public insurance reliance, and fragmented service and distribution, yet there's no campus embedded behavioral health clinic serving this area. Infrastructure is not always aligned with the demand. As an HBCU embedded within the service area, Coppin State University is uniquely positioned to expand trauma-informed, culturally responsive behavioral health services. A campus-embedded clinic would increase safety net capacity, reduce service fragmentation, and strengthen the behavioral health workforce pipeline. These findings support issuance of a certificate of need. If structural policies shape the problem, then anchor institutions can help reshape access. Thank you, and I welcome questions.